so for this portion of the exam, we're going to be doing assessing our cranial nerves. So we're going to assess our first cranial nerve, the olfactory cranial nerve. All right, so we're going to assess sense of smell. So I'm going to have you close your eyes during this, and you're going to close your right nostril, have you smell something, then your left, and have you smell something. You just tell me what it is, okay? All right, can you close your eyes? All right. Can you close your right nostril? All right. Tell me what it is.
Mint.
All right. Now for our other one, can you close the other nostril? Tell me what it is.
Baby powder.
Yeah, good deal. So our first cranial nerve is intact. So now we're going to go into our second cranial nerve, the optic nerve. I'm going to assess your visual field. So I'm going to kind of move my hands like this. You just let me know when you see my fingers moving, okay?
No.
All right.
No.
Good.
No.
Good.
No.
Good. So our second cranial nerve is intact. So now we're going to go into our third, fourth, and sixth cranial nerves, our oculomotor, our trochlear, and our abducens. So I want you to just keep your head straight, and with your eyes, just follow my finger, okay? We're going to go to the 6 cardinal fields of gaze. All right. All right, we're going to hold for our lateral gaze and note for nystagmus. There's no nystagmus noted. All right, now we're going to perform the cover and uncover test with this card we got. So I'm just going to cover your eyes, look straight. Good. Good. So we had no shift in gaze or extra eye movements, so our third, fourth, and sixth cranial nerves are intact. So now we're going to assess your fifth cranial nerve, the trigeminal. So I want you to clench your teeth, please. I'm going to palpate your temporal and masseter muscles. Good. So our muscles are firm, even, and symmetric on both sides. And from earlier, you remember doing the light touch and sharp and dull. So we're going to do this on your cheek, jaw, and forehead, okay? So just a reminder, that would be light touch, that'd be dull, that'd be sharp. All right, so can you close your eyes? And just let me know when you feel it, okay?
No.
Good. So now we're going to go into our sharp and dull. So can you just let me know what it is?
Sharp. Dull. Sharp. 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 Dull. Sharp.
Good. So our fifth cranial nerve, the trigeminal nerve, is intact. So now we're going to go into our seventh cranial nerve. We're going to observe some facial expressions. So can you raise your eyebrows, please? Can you smile? Can you squint your face together? And give me a shock look? Good. So all of our facial movements are symmetric and even. So our seventh cranial nerve is intact. So now we're going to go into our eighth cranial nerve, the auditory nerve. So we're going to use a tuning fork. We're going to use assess for a Weber's test and a Ryan's test. So for the Weber's test, I'm going to strike this, place on your midline of your skull, and you let me know what ear you hear it in. If you just hear them one or both, then let me know when you don't hear it anymore. All right, so can you close your eyes? All right.
Stop.
Good. So we have no unilateral hearing loss, as it was heard in both ears equally. All right, so now we're going to do a Ryan test. I'm going to place this on your mastoid bone after I strike it, and just let me know when you hear it, and then eventually let me know when you don't hear it, okay? All right. So for this, I'm going to time it.
Stop.
All right. Now we're going to go on to our other side. So air conduction was heard roughly as twice as long as bone conduction. So we have no conductive hearing loss. Good, so our eighth cranial nerve is intact. So now we're going to go into our ninth and 10th cranial nerves, our glossopharyngeal and our vagus nerve, okay? So I'm going to ask if you can open your mouth up. I'm going to use a tongue depressor. I'm going to look at your uvula real quick. All right. Can you say ah?
Uh,
Alright, so our uvula moved up inappropriately. Alright. So now I want to ask you to take a drink of water. Yep. So our swallow reflex is intact. Now we're going to assess for a gag reflex. Just sorry about this. Bear with me. Alright. So our gag reflex is intact. So our 9th and 10th cranial nerves were intact. So now we're going to go into our 11th cranial nerve, our spinal accessory. So I'm going to have you shrug your shoulders against resistance and turn your head against resistance both ways. Alright. Good. Turn. Good. Good. So we had appropriate muscle strength, so our 11th cranial nerve is intact. So now we're going to go into our last cranial nerve, the hypoglossal. So we're going to observe tongue movement, and symmetry, and strength. So can you stick your tongue out? Good. Move it side to side. So our tongue movement was symmetrical and even. So now I'm going to assess the strength. So I want to have you just, I'm going to place my hands on your cheeks and move with your tongues like that against some resistance, okay? Good. So our tongue movement was symmetric, it was even, and our strength was a 5 out of 5. So our 12th cranial nerve was intact. And that completes this portion of the exam. We're going to go on to our next one.